So I'm responding to my last video in which I posted about a woman who hadn't seen her GP for 10 years and ended up in A&E on my medical on-call shift with rip-roaring type 2 diabetes, which was absolutely preventable. And re_underscore with an alien profile picture has said with what GP appointments this is so patronizing and absolutely tone deaf. So re_alien, the tone of my last video was actually to try and empower people. I'm not trying to patronize anyone at all. I know how difficult it is to see your GP, but that's been the case for a while. I think it has been a bit worse since the pandemic, but yeah, it is difficult to get GP or even, hospital doctors' appointments. But I'm not trying to patronize anyone. I'm really trying to just empower people to not sit around and wait for a phone call. People seem to expect these days that someone's going to call them up and take responsibility of their health, ask them to come in and have a blood test. If you can read and write and you live in the UK, then you should be having regular blood tests. You can call up your GP and ask for a blood test. You don't need a GP appointment for that. You just ask for a blood test and then ask for the results. So, yeah, my intention is always to empower people to spread knowledge and awareness of metabolic diseases, particularly prediabetes and type 2 diabetes, and let people know that these are reversible conditions and that you need to take responsibility. Don't sit around and wait for a text message or a phone call for an appointment. If you are over the age of 40, if you have other medical conditions, if you have a family history of prediabetes, type 2 diabetes, cholesterol, blood pressure, heart disease, fatty liver disease, even PCOS, if you've had gestational diabetes in a previous pregnancy, if you have kidney disease, for example, if you have any other chronic medical condition, if you're over the age of 40 and you're considered a high risk category, you need to go have a yearly blood test. You don't need a doctor's appointment, just ask for a blood test and then follow up with the results. You can book a doctor's appointment after that. I really hope that helps and I hope that clarifies my message. Many thanks.